Hello, I'm going to try and, not waffle too much. So this is an update on Edith and everything that's going on with her. I don't know if I updated last time. We ended up getting her very first speech and language therapy appointment the day before her hearing test. So I'll go over that one first. I'm so good at this. So we went along and there was a lot of play, and the woman was checking what words she could say and also seeing how her understanding was. And if, when she was saying, Edith, can you touch the dolly's eyes? Edith would do it. Edith, can you go and get this? Edith would do it. So the understanding was there, but she just wasn't talking. And she doesn't really talk. And I did say, if you say to her, can you say something? She will repeat it to you, which I know technically in the training session they said not to do that, but... I said the thing is she just chooses not to talk. She can talk and the understanding is there, but she just doesn't talk. And sometimes she does talk, but she talks in Edith language, which is just noise. Cute noise, but still just noise. So that's a little bit different, and it keeps going white, so I have to keep touching the thing like focus. Hi. Sorry. And so, yeah. They've turned around and said, it sounds really backwards, but I'm sure they know what they're talking about. She doesn't talk enough for speech therapy, which sounds backwards to me, but apparently because her issue is more with choosing not to talk, there's not much they can do with speech therapy, like as in getting her to say certain words. And also, because she's had a multidisciplinary assessment done, an MDA or something, that there is an element of speech and language therapy in there that's probably going to be more helpful to her at this point. However, what I am going to do is I'm going to go along where we do a play session and they film me, which sounds really creepy. I know I vlog and I film myself, so, maybe less creepy to you, but for me it's weird because it's normally on my terms. And also you're really worried about, like, what happens if you mess up or you do something and everyone goes, oh, terrible parenting. It's scary. But they're going to film us and then watch it and see how we interact and give me tips on how I can improve. And I mean, obviously no one's like, yay, someone tell me where I'm going wrong, tell me how to better myself. It is sort of like almost embarrassing, but do you know what, I'm doing it. I'm all over that. I don't want to do it. It's creepy to me, but I'm doing it because if they can give me tips that will make things better or easier for Edith, then I'm all over that. I'm there with bells on, as they say. So yeah, we're a bit stuck. We're going to go back in 4 months and maybe look into doing speech language therapy sort of like sessions then. But until then, we're kind of like, can't do anything else until they get hold of me to go and play with her in a creepy way. Then hearing test, I don't know if I'm pleased or not, but her hearing's perfect. And I think, it sounds stupid, it was the last possible thing it could have been and not been autism, pretty much. It's the last feasible thing that it could be that wasn't autism. And it's not that. So even the woman at speech language therapy said, I'm pretty sure she's on the spectrum somewhere. She's not fully autistic, but I would definitely say she's on the spectrum. And hearing people said the same. She's probably just autistic. And it's silly because every now and then I have a wobble. I do, I'm not going to lie, I have a wobble. And I don't really know. It's sad. And then I feel guilty because I've got this healthy, happy, perfect, whole, amazing, wonderful little girl who is not in it. Well, she is kind of in and out of hospital at the minute, but just for the diagnosis. She is healthy. She is so healthy and so happy. And I don't have to like peg feed her, and she doesn't have a suprapubic catheter, and she's not wheelchair bound, and she's not spending half of her life in hospital fighting battles and having operations. And I'm so grateful for that. I really, really am. And I hate that it upsets me at all because I feel like I'm an ungrateful cow. But I'm not, and I know that other people like Narelle, whose daughter is, significantly autistic, whereas Edith's only moderately autistic, or I'm deluding myself, I don't know. And I'm really grateful for the fact that she does communicate and she's affectionate and she's toilet trained, which, is really handy. But it doesn't stop the fact there is that little bit of a pang in your heart for the sake of your child more than anything. It's not a selfish thing. I mean, don't get me wrong, going around the supermarket like Sainsbury's and having people give you a dirty look and mutterings about terrible parenting because your kid's like having a meltdown. But I can get away with that at the minute because she's so little that people just assume she's a spoiled toddler. Whereas when she gets bigger, I can imagine that's going to be a lot harder. It's going to be harder, but I suppose people then also assume that it's more likely there's something different, that your child has additional needs. than they do with a toddler. They just think you're like a crap mum or something, or your kid's just really irritating, which to be fair, she can be. So it is a mixed bag. It is mixed emotions at the minute. I'm glad her hearing's good. I am, because I mean that's great. I'm sad that it's not that's causing the speech delay, that it is more likely to be autism, but you know, I've got a massive amount of support, and again, thanks to everyone. I really genuinely just absolutely love you people. You are amazing. And even those that don't necessarily have any knowledge, just saying, you know, I'm really sorry, but you know, she really is an amazing, wonderful, brilliant girl. The amount of messages I've said that, you know, that I've had that have said, I'm sorry for your sadness, but I've got to say she's an amazing child and she really is brilliant. And that's really lovely, because I think she's amazing. I'm actually very lucky that I think she is damn amazing. But yeah, and I am grateful for everything, and I'm waffling a lot now, so I'm going to shut up. But yes, it's now just back to waiting for the appointment where I go and play and be filmed, and then waiting for the MDA or whatever happens next with the multidisciplinary assessment, waiting to get back from the paediatrician doctor person that deals with like autism diagnosis. So we're in limbo land, and I was in limbo land with the IVF. Now I'm in limbo land with the sort of autism diagnosis. So apparently I like it here. There should be more cocktails, I've decided, in limbo land. You know, because like limbo, there isn't that like a luau thing with cocktails and stuff. I'm thinking my limbo land should be way more like a luau, and then I'm going to go and buy cocktails. So yeah, I will love you and leave you, and I will speak to you all soon. I will update beginning of next week about surrogacy, because, you know, there's some wheels in motion over that at the minute. So that's sort of exciting, but not enough of anything yet to really say anything about. So yeah, I will speak to you soon. I hope you're having a lovely week, and please keep your fingers crossed for me to win the Euro Millions jackpot this Friday. I'd be uber grateful, because, you know, I want to win. There's no need to me, I'm just saying that because I want to. All right, bye.